Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be tackling something that millions suffer from in silence, tinnitus, or tinnitus, you may have heard it pronounced. That's a ringing, buzzing, or hissing in the ear that just won't go away. It can rob people of sleep, peace of mind, and quality of life. To help us understand this condition better, I've invited and I'm joined by a true leader in integrative and regenerative medicine, Dr. Bryn Henderson, a physician whose work combines cutting-edge treatments with a whole body approach. Here today, he will share his insights, innovations, and hope for those living with tinnitus. Dr. Henderson, it is a pleasure to have you on Doctor to Doctor. Let's start with what is tinnitus or tinnitus?
Tinnitus is when a person hears a sound like ringing, buzzing, or humming that is not actually coming from the environment. It's only a sound that they can hear. For some, it's a soft background noise. For others, it's loud, it's nonstop, and it's not a disease in itself, but rather a symptom of something that's going on in the auditory system, which includes the ear, the hearing nerve, or even the brain. The ear anatomy has a canal, a cochlea, an auditory nerve, and a brain connection. And possibly the causes like infection, injury, and earwax blockage can be revealed with a simple physical exam.
You know, in my practice, I have enough of patients with ringing in their ears. It's not that common, but what is the actual percentage around the globe?
Good question. It's actually very common. Globally, 10 to 15% of people experience tinnitus at some point in their life. In the United States alone, over 50 million people are affected. For some, it's just an annoyance. But for others, it's chronic, life-disrupting, interferes with their sleep, focus, and emotional health. It's a big deal.
Yeah, I would hate to have a buzzing sound in my ear all the time. You wouldn't be able to think clearly. Well, let's have some causes that we can present to our audience.
The most common is damage to the tiny hairs in the inner ear, often from loud noises like concerts, headphones. I've seen it a lot in the military where people with howitzers are shooting off artillery or something, or factory workers is another good reason. Other causes include ear infections, age-related hearing loss, head or neck injuries, and even some medicines. In some cases, there's no clear trigger, but we know the treatment can help.
Okay, so I'm interested in what medications you have come across that maybe damage the little tiny hairs inside our ear. I know you spend at least 4 or 5 hours a day researching.
The most common causes are antibiotics.
Really?
Yeah.
Uh-oh.
All the doxys and the gentamicin.
Uh-oh.
Most of the time, if it damages a kidney, it can impact the ear.
That is fascinating.
Yeah, so both develop at the 12th embryological week.
I always heard that the ear and your shape of your ear is the shape of your kidney. So, okay, so this is really getting interesting now. All right, so you've mentioned those, and we've talked about on other shows genetics because, of course, DNA is so popular now, and everybody knows the word DNA, and probably half the country has had their DNA done. And probably a tenth of those that had their DNA done had the health genetic test done. So what is the link to genetics or development at the embryological stage?
Well, there's a predisposition. Sometimes it's overlooked, meaning tinnitus runs in the family, even in the womb. That's a big deal. Problems like infections, poor nutrition, or exposure to harmful substances can affect how the baby's hearing develops. These are early factors that can set the stage for problems, including tinnitus later in life.
Okay, so when someone walks into your clinic, of innovative medicine, and they say, Doc, I've got ringing in my ears, help me, help me. And they're usually pretty desperate
and frustrated.
Hmm.
And we do start by listening to their history. And when we examine their ears, we do two or three things, one of which is we listen to it with a stethoscope to see if we can hear the noise.
How do you do that? What? Wait a minute.
Yeah, we have digital stethoscopes, so we can just put on the ear, just like we would the heart, and we can listen. And you want to know, is it a high pitch? Is it a low pitch? Is it constant? Is it intermittent? But then we go after that history. That's when we start into that part, the examination. And that also has a tympanometer, if necessary, and an audiometer all the time. A tympanometer tells us how the movement of the tympanic membrane, is it normal or not? If there's fluid behind it, usually it's infection. It's done in pediatrics all the time. And the audiometer tells us if you can hear low or high frequencies.
Okay, so a person goes in, they get into that horrible and have an MRI of their head, which I've had one before. And the worst thing for me is the clanging noise of the metal. But let's skip to the chase. What does the MRI show in tinnitus?
What you're looking for is if there's some tumor or